February is American Heart Month. Students in Central Maine are getting a hands-on education about treating heart-related medical issues. Kadichi Lawrence has more.
The Simulation Center in Waterville provides aspiring nurses with hands-on experience through real-life simulated events. Those students cared for a patient with heart failure Monday.
Listening to the lungs and heart, medications, education.
A partnership with Northern Lights Inland Hospital and Purdue Global Simulation Center.
We have actually been kind of working through Heart Health Month since the beginning of February. We've done a few different events. We recognize National Wear Red Day.
Melissa Goodwin is the academic program head for Purdue Global's pre-licensure nursing program.
So when you think about heart health, we actually hit it at multiple levels. It starts clear back in anatomy and physiology when they learn the structure of the heart. Then they move into pathophysiology and learn about disease processes of the heart.
Students will take turns to visit the patient.
Good morning, Mary. My name is Brandy. I'm going to be your nurse.
While others observe in a separate room. For the first time, they are applying what they have learned to a patient at the Simulation Center.
Would you like some medication for the nausea? Oh, please.
The one nice thing about simulation is it is meant to be a safe space for students to learn and practice information so that they can work on developing those critical thinking skills when they have a real patient in front of them.
From checking vitals to administering medication, Goodwin says changing the patient's response in the control room gives the students real-life patient situations.
Students really do cite that they feel more prepared to interact with live patients and do those assessments when they have been able to practice in a realistic, safe space like this.
And they have the opportunity to review
what went well, what parts do they struggle with, and then can educate in those scenarios.
The partnership with Inland Hospital allows the students to work hand in hand with nurses. And while treating patients is important, Goodwin says prevention is key.
We're having them practice patient education coming into the room and talking to the patient about when they go home, what does that look like? And so we've been trying to tie Heart Health Month into that so that we're being more preventative and proactive instead of reactive.
Kadichi Lawrence, WABI TV5 News, Waterville.